Thank you very much. Good morning. So I'm going to talk about today the Framework Convention on Tobacco Control, the potential for a harm reduction under the Framework Convention, the Framework Convention's relationship to good governance, and the implications for public health. So I'm going to begin by discussing the Framework Convention, its objectives, and then I'm going to Is this? Okay, here we go. And then I'm going to talk about... so I'm going to talk about the degree to which tobacco consumption has changed as a result of the Framework Convention or not, and what the lessons are from richer countries, the change in tobacco consumption in richer countries. I'm going to talk about whether or not the Framework Convention has embraced harm reduction as a solution to improving public health. I'm going to talk about the implications of that for what the WHO and many academics now call electronic nicotine delivery systems, could be called e-cigarettes, could be called electronic vapor products, more accurately perhaps. I'm going to talk about good governance at the United Nations in principle and in practice at the Framework Convention on Tobacco Control. And then I'm going to talk about how we might improve the governance of the Framework Convention on Tobacco Control so it acts more in the interests of consumers and the public in general. So that the objective of the Framework Convention on Tobacco Control is specified very clearly in Article 3 of the Convention. And it says that it is to protect present and future generations from the devastating health, social and environmental and economic consequences of tobacco consumption and exposure to tobacco smoke. It's there to provide a framework for tobacco control measures to be implemented by the parties at the national, regional, international levels in order to reduce continually, substantially, the prevalence of tobacco use and exposure to tobacco smoke. It seems pretty clear to me what its objectives are. So what's actually happened in terms of tobacco consumption over the course of the past 11 years since so the convention was agreed in 2003 and came into force in 2005. So over that time, smoking prevalence around the world has continued to decline. But here you can see that in China, whilst it fell during the late 90s and early 2000s, actually since the convention came into force, it's slightly risen. But around the world, it's continued to decline at a fairly steady rate. Doesn't seem to be much change since the convention came into force. Now let's look, though, at the total number of smokers. Total number of smokers has risen both in China and around the world. That's largely a result of increase in population, of course. These numbers are from the Institute for Health Metrics and Evaluation. I took them from an article in the New York Times. I'm not very sophisticated, am I? Okay, so let's quickly look at tobacco use over the period 1997 to 2013. And you can see that cigarette sales have gone up over that period, especially, and most of that rise has come from an increase in the Asia-Pacific region, and especially in China, but also it's gone up in the Middle East and Africa. And you can see there the top 4 countries for cigarettes by sales, with Russia having gone from being number 3 to now number 1 in those countries outside China. This is kind of interesting because the Framework Convention on Tobacco Control specifically sought to reduce consumption in Asia, the Middle East, and Africa. And yet those are really the places where it's gone up over that time. So I think it's worth looking at why tobacco consumption fell in richer countries. Because you'd think that would provide some lessons for the Framework Convention as to what would be good solutions to reduce consumption elsewhere. And the data is pretty clear that the main drivers of the reduction in tobacco consumption could be split into 2 elements. The first is demand reduction, and in the context of demand reduction, you see taxes that have driven up the price of cigarettes. You've seen the role of sorry, I don't know why this, oh, here we go. Public information campaigns, various kinds. I mean, so for example, the Surgeon General's report in the United States in 1964 was had a huge impact. And some other aspects. So in the United States, specifically, you've got the requirement that television advertising be given to anti-tobacco advertisements over a period in the late 1960s. But in other places, things like the requirement that cigarette advertisements have warnings about the dangers of cigarettes. All these things had an impact. Quit aids also probably have had an impact. The availability of nicotine replacement therapy, as well as advice from doctors and so on. So these things have unambiguously had an impact on consumption of tobacco products. But we also see an impact of harm reduction. And in particular, in Norway and Sweden, you've seen beneficial effects from people switching to snus. And more recently, you've seen a beneficial effect from people, especially in Europe and the US, and increasingly in other parts of the world, switching to electronic vapor products. So the FCTC advocates these things, right? I mean, logically, right? So you'd think so. I mean, we know what works. And broadly speaking, you'd expect the FCTC to follow that and to advocate them. And you've got clear evidence that demand reduction policies of those kinds that we've suggested work very well, and that harm reduction measures work. Well, yes, they've advocated in demand reduction, but they have not advocated harm reduction. They've been quite hostile, in fact, to harm reduction tools. And this is ironic because the FCTC, in its definition of tobacco control, includes harm reduction. It says that tobacco control means a range of supply, demand, and harm reduction strategies that aim to improve the health of the population by eliminating or reducing their consumption of tobacco products and exposure to tobacco smoke. So why has the FCTC not adopted harm reduction? I think fundamentally, you see that FCTC and the member organizations, the health ministries, seem to be dominated by the idea of quit or die. You can understand that historically, that harm reduction tools that were developed in the 1960s, or the attempts at harm reduction tools that were developed in the 1960s, 1970s, and so on, these things that tobacco companies produce, better filters and so on, weren't actually very effective at reducing harm. So I think that hardened the public health communities, or certain elements in the public health communities, skepticism towards harm reduction, and you saw the emergence of a sort of hardened community around the quit or die approach, and that seems to be now dominant at the World Health Organization, in the FCTC Secretariat, and in the various ministries who are representative at the FCTC. And you see it in WHO reports like this one, the 2006 report on tobacco deadly in any form or disguise, where it states all tobacco products are harmful and addictive and all can cause disease and death. In that same report, they intentionally conflated high and low risk products. They talked about snus. They talked about evidence that snus might be safer, although they put in brackets that this was from reports produced by Swedish Match. But they ended that paragraph about snus by stating, a recent review of smokeless tobacco by the International Agency for Research on Cancer concluded that smokeless tobacco is carcinogenic, making no exception for Swedish snus. And underlying this opposition is a demand for very, very high standards of evidence. So in that report, it says that for new products and those under development, additional research is needed to understand more precisely whether their risks are the same as the products that they would replace. And it says such research will take years or even decades, and until such research is completed, the most prudent course is to assume that the health risks are extraordinarily high compared to any other consumer product and basically prevent their use. How many decades of evidence is required by the WHO? I ask you. So this report was from 2003. I used this there's better evidence going forward. But this report was from 2003, and I use it because it was 3 years before the WHO report on tobacco harmful in any shape or disguise. Why is WHO ignoring decades of evidence and claiming that more decades of evidence are required? It seems irrational. And unfortunately, it's then parlayed that precautionary thinking, that idea that you need decades of epidemiological evidence to justify the support for any harm reduction measures into its approach on ends. And a series of reports going back to 2008, and this is a tweet from 2013, until e-cigarettes are deemed safe, approved by competent national regulatory body, consumers should be strongly advised not to use them. I mean, really? I'm not going to go into the evidence that ends are safer. We've had enough of that at this conference, but it's merely worth repeating what was decided at COP6 in relation to ends. That parties are invited to prevent initiation. Well, how do you prevent initiation among non-smokers and youth while also trying to encourage people to switch? It's a real challenge. How do you minimize potential health risk? What is a potential health risk? How do you protect non-users from exposure to their emissions? What are you protecting them from? Is there evidence that there's actually anything to be protected from? How do you prevent unproven health claims? How do you prove a health claim? I mean, clearly you need decades of evidence, therefore. How do you protect tobacco control activities from all vested interests? What do we mean here? Does that mean like any organization that has any association with the production of ENDs, production EVPs? Doesn't it also apply to pharmaceutical companies? Just saying that maybe the 3 pharmaceutical related organizations that are observers to the FCTC might have conflicts at some level. And then consider prohibiting or regulating, but prohibiting devices as tobacco products, medicinal products. Now, if they went for consumer products, maybe we'd be in good shape, but I think that the clear message here is that they want either the regulations as tobacco products, as the US is doing, and the EU is doing, or medicinal products, as you've seen the wonderful successes of that in Australia, Canada, and so on. And then they want to ban or restrict, ban advertising, which is clearly going to be wonderful for the ability of consumers to obtain information about the relative safety of these products and how they might be able to switch. I think underlying the problems at the FCTC is that they fail to comply. The FCTC fails to comply with the UN's own principles of good governance, which are specified here. These are principles that have been developed by the UN Development Programme, and that the UNDP makes a strong case, I think persuasive case, that these principles underlie a sustainable social and economic development. There must be participation and consensus. There must be the way in which the organization is governed must be participatory and consensus-oriented. There must be a strategic long-term vision. It must be responsive, effective, and efficient. It must be accountable and transparent, and there must be fairness. Now, I'm going to go quickly through some of these and talk about the degree to which FCTC complies with these things. So when we look at whether or not the FCTC is participatory, well, I think we see quite clearly that there is extreme limits on the degree of its participation. Currently, the FCTC allows 26 observers, that is, groups, civil society organizations, to be engaged with it on an ongoing basis. By contrast, the United Nations Framework Convention on Climate Change allows over 2,000 observers to be involved in the deliberations. I think that's a pretty extreme contrast between the two different conventions. At COP6, even people in the public gallery who aren't official observers, but who are able to see what's going on, were removed. So there were civil society organisations in the public gallery on the first day of the convention of the parties in Moscow. They were chucked out, along with media. Along with media, really is quite a violent kind of contradiction of the principle of participation. Does the FCTC have strategic vision? Well, I would say that the FCTC, because of its opposition to harm reduction, is at odds with the long-term interests of smokers, smokers who are unable to quit. Smokers who are unable to quit are seen as second-class citizens. The only option for them, under the motto of the FCTC, quit or die, is to die. Whether or not the FCTC adheres to or understands the historical, cultural, and social complexities of smokers and vapers, I'm not sure, but you'd be better able to understand that. I suspect probably not. Is it responsive, effective, and efficient? Well, I mean, it seems to me that it's not responsive it doesn't serve vapers and smokers who want to use reduced risk products. It's not doing them any favors. It's not responsive to them. Is it effective and efficient? Well, it promotes some effective measures, as I've talked about, the demand reduction measures, but it doesn't promote harm reduction. But at the same time, it promotes, like currently there's talk about things such as limiting nicotine content of cigarettes, which is at best going to have very little effect, and it might be even counterproductive. So I would say that it is neither effective nor efficient relative to what is possible. Is it accountable and transparent? Well, as we've heard throughout this meeting, it's clearly not accountable to a big part of the people who would be affected by it. It's not accountable to smokers and vapers. It doesn't do things in great measure. It doesn't do things, and it's doing things. It doesn't do things in favour of them, and it does some things which are almost certainly harmful to them. Is it fair? So fairness entails a combination of equity and rule of law. I've got a quote here from Benjamin Mason Mayer and Donna Shelley, who wrote a paper on the FCTC and the human rights, the human right to health, where they argue, I think quite persuasively, that based upon its dignity-enhancing and life-saving potential, harm reduction is a fundamental component of the right to health. So the fact that the FCTC does not advocate effectively for harm reduction, I think suggests that it is not fair. In other words, if you look at all of the components of good governance, the FCTC essentially fails the test. It is not a well-governed organisation. And a large part of the problem, not all of the problem, but a large part of the problem is its excessively broad interpretation of Article 5.3. Article 5.3 says that in setting and implementing their public health policies with respect to tobacco control, parties shall act to protect these policies from commercial and other vested interests of the tobacco industry in accordance with national law. Well, this is a reasonable article, I would argue. It's a good thing to protect public health from vested interests. It could help prevent conflicts of interests. But in practice, it's been used as a justification for limiting observer status to anyone not in the quit or die camp, even to the extent, as I've said, of removing media and others from the public gallery. So I think I'm worried, given the history, given what's been said already, given the decisions at COP6, where it was decided in secret because of course the observers, so everyone other than the organisations with observer status had been eliminated from the room. It was decided in secret to commission an expert report, another expert report, by the way, we've had 2 already, an expert report with independent scientists and concerned regulators for the 7th Conference of the Parties, which will be held in Delhi in November, with an update on the evidence of the health impacts of ENDS and electronic non-nicotine delivery systems, the potential role in quitting tobacco usage, impact on tobacco control efforts, and to subsequently assess policy options. This report has been prepared in secret. If anybody in the room knows who is preparing the report, I think we'd all like to know. And we'd like to know also what the report says. It's not clear that there's going to be any review by people here, by the affected parties, by people who are users, consumers of vape products, and potential consumers of vape products. It's unclear that any of those affected will be present at COP7 to offer their insights. Maybe one or more of the organisations here will be able to attend. I mean, it requires applying and getting accepted. That would be good. And will the FCTC be held to account for whatever decisions that it makes? I don't know. So how do we improve the FCTC's governance and move it towards support harm reduction? I think it's important that observer status be granted to key stakeholders with a harm reduction focus. That means academics who have an expertise in this, public health groups who actually believe in harm reduction, vape groups that have been advocating the use of these harm reduction tools and so on. I think it's essential that media be allowed to participate at the meeting so that we can hear what's going on. Why doesn't the FCTC live stream its proceedings like the Framework Convention on Climate Change did recently? Another set of related things. I think a much more transparent process for the selection of experts for those who produce reports. Public sharing of draft reports so that they can be commented on and critiqued. These are all basic elements of good governance that have been advocated by the United Nations and also, I would say, in a recent very good review by the European Union. So then the final question is, what can you do? I think those affiliated with harm reduction groups, whether you're academics or vape groups, is to seek observer status with the FCTC. I just remind you that the deadline for that is August the 7th, and there is a form on the website that you have to fill out. To reach out to governments, we talked about this yesterday with the consumers, reach out to governments, and I would construe that broadly, so not just ministries of health, but others who would be might be participating in the FCTC, to explain the importance of including harm reduction, to develop petitions. Well, actually, might say more a declaration or two on the importance of including harm reduction and expanding observer status at the FCTC. And then journalists seek to attend the FCTC and don't let them bully you into leaving. Raise concerns about the threat of restrictions on media participation. And finally, if you're in Delhi around the time of the FCTC meeting, we're planning to hold a conference on harm reduction just before and on probably, well, 6th and 7th, so the day before and on the day of the meeting. I'm going to be coordinating with the groups that were deciding yesterday to organise their own events, so we don't conflict. So we'll work out the timing. But at the end of the day, don't take my word for it. A famous person once said, if only those with power would listen to and incorporate the experience of those who have first-hand knowledge of the reality of the situation on the ground, the results would transform the ideas of leadership and decision-making. And that was Mary Robinson, the former UN High Commissioner for Human Rights. But I'd also note this, that the power of civil society and the activist community to generate grassroots pressure can ignite policy change. So thanks very much for listening. Do contact me. I'd love to hear from you and be involved. Thank you.